Dr. Alan Macfarlane, thank you so much for joining me for this 5-minute interview about RE UK 21. How are you doing?
I'm okay, Amit. How are you?
I'm very good, thank you. So, Alan, you and I have been friends for a while. We've been on the RE UK board together, and now at the end of RE UK 21, you will be taking over the presidency from me. So I'm very much looking forward to handing it over to you. I wanted to start off this short video by asking you what you're most looking forward to about RE UK 21.
What am I looking forward to? Gosh, I mean, there's so much stuff. I'm at the faculty. We've got some of the best regional anaesthetists in the UK. We've got world leaders coming internationally, obviously, with Ed and Steve Haskins and Keijin and Eric Albrecht from Switzerland. So we've got a fantastic international and national faculty. The content of the program is just brilliant. What you and Dave and Kim have put together. The first day we've got all the live scanning and the clinical scenarios. Day two, just there's so much variety with the short, snappy talks. We've got obstetrics, day surgery, environmental issues, human factors, consent, so much stuff. The program just looks fantastic. So hopefully something for everyone,
It
from
sounds
novices
like
up
it.
to the yep. I think so.
So, I mean, I think you've pretty much done the ideal plug there. But what I would push you on is, if you were to speak to a colleague or to a trainee today and to tell them why they should register for RUK, what would you say?
Well, I think just all these things. There's so much stuff that we've just said there. You can do in 2 days, and for £50, what a bargain! I mean, I'm a canny Scot, so £50 for a consultant, 25 for a trainee. So, I think that's a great price. And as you know, you can access that for a year afterwards. So even if you can't get the study leave to come for those 2 days, then sign up. And watch it at your leisure. But hopefully get the 2 days off and have a wee party with everyone else in the department. And
Absolutely, socially distanced, of course, but you're quite right. And
of course, yes.
the other thing that's worthwhile mentioning is the fact that we've now opened up our RA UK membership to members all over the world, so you can get that discounted rate wherever you are in the world. And we also do have a separate price for people that come from lower and middle income countries. So everyone can get involved. So hopefully we can make this truly global.
Yeah, I mean you obviously know the figures, but we've read this is already the most highly attended meeting RUK have ever had, and it's hopefully going to be several hundred more over the next month or so get registered. So yeah, we're really excited to hopefully put on a good show. This is not going to be your average virtual conference. As you know, the whole factory are coming down to Sheffield, so we're going to try and make it a bit different with all the live scanning and the TV studio type theme. So hopefully it'll be.
So, Alan, you've watched a few of these videos before, so you know there's some questions coming up, and you know I'm going to ask you. So, let's start off by asking you to tell us what your favourite upper limb block is.
Yeah, I watched the infraclavicular seems to be obviously popular. I was always a supraclavicular boy coming from Toronto. I must say though, I am doing lots and lots of auxiliaries recently. I do like the proximal auxiliary approach and trying to get into intercostobrachial as well. So I'm actually doing a lot of them. So it's becoming a close run thing between the supraclavicular and a proximal auxiliary.
I'm going to have to pin you down to one of those, Alan. What's it going to be?
Oh, come on. Oh, it's hard to. I like the supraclavicular. I still like it.
What? Another supraclavicular. You and Dave Johnson are
Yeah.
in good company. Okay, fair enough. So you've got upper limb sorted. What about lower limb block?
Yeah, I was thinking about this, and because I do a lot more upper limb than I do lower limb. I still like the ankle block. It's obviously not one of our plan A blocks, but it's a lovely block to teach and to do. You've got at least 3 nerves you'll block with the ultrasound. Some people, you can just block the saphenous with a bit of skin infiltration, to be honest, but you can pick off the tibial and the deep and the superficial perineal with the ultrasound. So it's a nice block. It's safe. Yeah, and it's very satisfying. It works great for the ambulatory surgery that we do. So I like the ankle block actually.
Do you know, I think it's one of those blocks that once you've clocked how to do it and you can apply it in the right circumstances, whether you're doing it as a sole mode of anesthesia or whether you're doing it as an adjunct for GA, I think it's a brilliant block. It seems sometimes a shame when people block so proximally for something that's so distal. So actually, I like that. I think maximum respect for your choice there, and that brings us on to trunk blocks. So if you had to pick your favourite trunk block, what would you go with?
Yeah, I'm going to have to stick with the plan A rectus sheath. I like the rectus sheath block. I think it works very nicely. I still, it's strange how there's actually been very little work done, sort of evidence-wise, in terms of big studies, but clinically it works. It works very well. We've switched a lot of rectus sheath blocks and catheters locally, and we've get some good results with that. So I think the rectus sheath block's a good solid trunk block.
And hopefully there's some work coming out soon, or certainly studies are about to be undertaken with regards to rectus sheath blocks. So that's something coming our way. Although it was interesting, on Twitter recently there was a discussion that kind of surprised me that I was not aware about there being more than one endpoint for rectus sheath blocks. So maybe that's something we can pick up and talk about in RUK. Certainly that caused a little bit of discussion on Twitter. So that leaves me with saying thank you very much, Dr. Alan Macfarlane, President-elect, soon to be President of RUK. Thank you very much for all of the work you put in so far as Treasurer, and thank you so much for joining me for these short 5 minutes. I look forward to seeing you very soon, Alan. Take care.
Yeah, thank you. I don't know how I'm supposed to take over from you, but yes, thanks very much.
See you. Bye-bye.
See you later. Bye-bye.